I'm from Australia. I live in Queensland. I'm a 24-year Air Force veteran.
He complains about the left shoulder pain with history of an accident about 4 months, and he had some investigation, but it doesn't know what definitive of diagnosis of him. So I sent him to X-ray to screen about the bone first, that no fracture or anything. After that, I suspected he had some rotator cuff torn, so I sent him to investigate with MRI, and the MRI showed that he had a massive rotator cuff torn at the left shoulder. This rotator cuff, we had 4 tendons in this group. For him, he torn 3 of them. For his rotator cuff is like this. 3 of them torn and retract to the glenoid. So we advise him to operate because he have a traumatic massive of rotator cuff left shoulder. We have 2 options for him. First is arthroscopic partial rotator cuff repair because the torn is massive and retraction. Second one is reverse total shoulder arthroplasty. After discussion, he chose arthroscopic rotator cuff repair because of the aim. He want to repair the rotator cuff with his own tendon, and he want to decrease pain at the first aim of this operation. We use the new technique is called bicep FCR or bicep superior capsular reconstruction. You use the bicep tendon to help the rotator cuff to repair, to make more strength of the rotator cuff repair. And after the operation, we very happy about the operation because after 2 days, his pain is gone and he really happy, and after 1 week he can fly back to his home country. For the rotator cuff repair, I can guarantee for him about the pain that will decrease after the operation. But about the range of motion, about of the power of shoulder, we need to see after the rehabilitation, because after the operation, another important part is the physiotherapy. If he follow the physiotherapist and everything is under the process, I think the result will be good in the future.
I've had this accident for 4 months and I couldn't get through the system in Queensland, and the pain was so much I couldn't. I had to do something to relieve the pain. I waited 4 months and 1 day, and an orthopedic surgeon in my area, he went on holidays and you can't go anywhere else. And it looked like I may see him after Christmas. So I went home, I just Googled really, and I saw this on the internet, and my sisters said, wow, you take a chance and go there on your own. I said, I have to. I didn't even have an appointment here. I got here, I rang international desk and proceeded from there. When the doctor saw the image, he said massive tear. So that's the only qualified way I found out what it was. I have been warned by your doctor that, if anything should happen, I could lose up to 70%. But I'm right-handed. I'm no athlete anymore. So if I have lost a little bit, as long as the pain subsides, I really don't care. I really don't. I'm happy to go home. I'm quite happy that I came. That's how I felt. I can tell you now, I would give any recommendation that you wouldn't get better treatment than here. There isn't any. I wish I was sick so I could come back here, but I'm not. If you've ever had that sort of pain, it needs attention, and I've certainly got it. Thank you.